আমাদের নিত্য কিছু অভ্যাস যা আমরা অজান্তেই দিনের পর দিন করে চলেছি, সেই অভ্যাসই ক্যান্সারের ঝুঁকি ডেকে আনছে না তো?
lesser physical activity. Obesity in turn results into cancer.
पैकेट फूड, प्रोसेस फूड खाते हैं,
They're going to have a shelf life for 3 months, 4 months. Chemicals will irritate your intestinal lining.
chronic stress and lack of sleep.
Indirect ways of causing cancer, but it is not a direct causal association for cancer.
सोचते हैं कि वेपिंग और hookahs are safer than the smoking.
The alternatives are more harmful than a cigarette.
Many of us nowadays doing desk job.
Obesity is one of the leading cause of endometrial tumors in women. Postmenopausal obesity is directly resulted with breast tumors. At least 30 minutes to take care of your body.
Things like feeling tired and suddenly losing weight.
Is the weight loss intentional or unintentional? Symptoms like fever, night sweats. Any amount of alcohol is harmful. There is nothing called permissible limit or anything.
আচ্ছা, একবারও ভেবে দেখেছেন আমাদের নিত্য কিছু অভ্যাস যা আমরা অজান্তেই দিনের পর দিন করে চলেছি, সেই অভ্যাসই ক্যান্সারের ঝুঁকি ডেকে আনছে না তো? আজকের এই সুপারফাস্ট লাইফস্টাইল, ফাস্ট ফুড, রাত জাগা আর বুক ভর্তি স্ট্রেস কিভাবে এই মারণ অসুখকে আমাদের ড্রয়িং রুমে টেনে আনছে তা আমরা টেরই পাই না। অথচ একটু সচেতন হলেই কিন্তু সমস্যা সমাধান করা সম্ভব। এই বিষয়ে সচেতন করতেই আজকে দ্য ওয়াল আরোগ্যর নতুন হেলথ টকে আমি জিনিয়া। আমার সঙ্গে রয়েছে চেন্নাই অ্যাপোলো হসপিটালের কনসালটেন্ট মেডিকেল অনকোলজিস্ট ডক্টর নিরঞ্জন ভি। ওয়েলকাম ডাক্তার।
Namaste, ma'am.
Okay, doctor. What are the top 3 regular habits that we do regularly and we think that's a normal but that can cause cancer?
Okay, very good question to start, ma'am. Most commonly, what we feel thinking normal food items like eating the fast foods or ultra processed foods, where we day to day eat the food items what we consume, they are the one of the most leading causes of GA malignancies. Second thing is lesser physical activity. People are now considering more and more desk jobs. Between 8 to 8 they are working, reaching home late at night. As a result, they are less working, more obesity in turn results into cancer. And third, when they become more stressed, now the new norm is smoking is considered a normalcy. Drinking alcohol once was harmful to the society. Then people started thinking it is a social drinking. There is nothing called social drinking. Any alcohol is injurious. So these are the 3 common things what we feel it's normal is going to result in higher incidence of cancer in future.
So आजकल बहुत सारे लोग पैकेट फूड, प्रोसेस फूड खाते हैं।
Correct.
क्या ये पेट का कैंसर और कोलोरेक्टल कैंसर बढ़ाने में रिस्पॉन्सिबल है?
Correct, madam. Imagine you take a meat, keeping it outside. It rots in 1 day or 2 days. But when you take a milk or a thing, it rots in 1 or 2 days. But you look at the food items what we consume, they're going to have a shelf life for 3 months, 4 months. Are we not thinking something like, are we doing something wrong? These are the chemicals that are being asked to delay the degradation. In turn, these chemicals will irritate your intestinal lining. And that's one of the reasons for rapid increase in cancers among the younger adults in the country.
So chronic stress and lack of sleep lead to cancer, or it's just a myth?
Okay. See, people feel like stress, everything leads to cancer. What in general they're trying to say is, whenever you have a chronic injury or inflammation going on, that results in a different metabolic state in the body. It is not directly related to cancer, but chronic stress tends to make people to have other things like more sedentary lifestyle. People feel like they are getting depressed, so they don't want to go out, which in turn leads to other indirect ways of causing cancer, but it is not a direct causal association for cancer.
So आजकल के यूथ सोचते हैं कि वेपिंग और hookahs are safer than the smoking.
Okay.
So as a oncologist, what do you think?
Okay. To be frank, they are as harmful or even more harmful than smoking a cigarette. E-cigarettes, they contain some chemicals. When they heat, when they vaporize, they are not just water vapors. They also contain some heavy metals, which can cause your DNA damage and cause cancers in your lung as well. And the worst thing is the hookah. So shisha contains technically a tobacco. You are heating it with charcoal. So
Okay.
you are burning charcoal, creating fumes, and you are smoking tobacco. This is worse than using a smoking. So you are inhaling 100 to 200 times more chemicals in 1 hour when compared to smoking a cigarette for 1 hour. That doesn't mean smoking cigarette is beneficial. No, it is still harmful. The alternatives are more harmful than a cigarette.
So many of us nowadays doing desk job.
Correct.
So that we need to sit long hours,
Correct.
like 8 to 9 hours we need to sit.
Correct.
So sedentary lifestyles
Correct.
and weight gain, that is also a reason for increasing the risk of cancer.
Correct, ma'am. Whenever there is more sedentary lifestyle, obesity happens. There is a chemical called IGF, insulin growth factor, being produced. This IGF is a reason for triggering many cancers. So there is an entity called cancer corpus syndrome, where obesity is one of the leading cause of endometrial tumors in women. Postmenopausal obesity is directly resulted with breast tumors.
Okay.
Obesity can also cause colon malignancies and prostatic tumors. So we need to educate ourselves, like, okay, let's say I am working between 8 to 8, take at least a half an hour to 45 minutes break and try to engage in some form of moderate intensity physical activity. So like 30 to 45 minutes a day.
Acha.
Try to make sure that you spend at least 30 minutes to take care of your body rather than worrying when you have a disease in future. Because this obesity is also directly related to heart diseases, diabetes, hypertension, and so on.
Things like feeling tired and suddenly losing weight are very common.
Correct.
So when people will go to the doctor to consulting these things, or
Okay.
this is very normal.
Very good. Now there is a trend with people to lose weight. So what we generally ask some patient who come into the clinic fearing cancer is the weight loss intentional or unintentional? If you have an unintentional weight loss, more than 10% of your body weight in the over the last 6 months, with symptoms like fever, night sweats, and also having some blood in stools, and having an anemia and a weight loss. Anemia means low hemoglobin. So all these collectively will point towards somebody having a malignancy. So any unintentional weight loss with the other mentioned complaints should think that patient should reach to a doctor at the earliest.
So nowadays people do drink every day. So it's very normal habits, or what do you consider?
Okay, drinking is not normal. Point number one, that is the take home message. Any amount of alcohol is harmful. There is nothing called permissible limit or anything. There are nearly around 8 to 12 different malignancies which are directly associated with alcohol. In addition to smoking, it doubles or triples the risk of alcohol. So people nowadays, they have feeling like going to the party, if somebody is not drinking, they are considered abnormal. So don't worry, don't fall into the peers pressure. If you are somebody who is not drinking, that's good. There is no medical benefit. It is a known carcinogen, starting from the oral cavity, esophagus, your stomach,
Okay.
to your ovarian tumors. It's linked to almost 8 to 9 different types of cancers. The most common being your liver, whereas alcohol causes liver injury, which causes cirrhosis, which causes a liver cancer. So it is a direct causal association for a liver cancer.
Sir, if someone has had a bad lifestyle, or they can habituate with this kind of bad things, as you mentioned, so and suddenly he changed. So what do you think? They can change their risk of cancer, or?
Correct. See, even stopping cigarette will try to bring back your ciliary motility in some time. Similarly, the ones if you stop, at least you are not introducing any extra cancer causing substance into your body. That itself reduces your extra insult. And somebody who has stopped smoking or alcohol or quit all the bad habits, it may take at least, say, for example, 10 to 15 years for him to have his risk of cancer similar to that of a general population. So at least, let's assume somebody has a disease who has smoked, and we request them to stop smoking or consuming alcohol at least the moment they get diagnosed. and somebody who continues to smoke during the treatment has worse survival than for somebody who has stopped it. So stop it, you hit a restart button in your life.
Okay.
At least you'll get a new life so that you can take care of your body in a better way.
So लोग कहते हैं मेरा दादा ने कभी स्मोकिंग नहीं किए. So what do you think, this is a genetic luck or lifestyle risk?
Very good. Many patients, like just like what you asked, come to the OPD and say, I didn't smoke, I didn't drink alcohol, my friends did everything, he's not having cancer, I am having. Why there is a difference? See, what probably I would tell my patients who come to the clinic is, probably you are having some genetic predisposition, and imagine it is like a gun, and the environmental factor is the trigger. It shoots. So that's how it happens. So you might be genetically predisposed, not everybody. The amount of environmental risk factors like lifestyle changes and the alcohol, smoking, and for example a viral infection can cause a sudden trigger. So all those triggers together results in a malignancy or a cancer. It is not just smoking, it's not just genetic. It should be a combination of genetic, environmental, and other external factors will converge into formation of a cancer.
So what is a one golden rule that you want to mention to the audience so that they can follow it and prevent the cancer risk?
Okay, I would like to say probably 3, not 1.
Okay.
First thing is quit smoking alcohol. That's number 1 take home message. Number 2, try to do 30 to 45 minutes a day, some form of physical activity. Okay, at least 5 to 6 days a week is what is minimum recommended for any healthy human beings. Number 2. 3, third and most important thing, there is a concept called time restricted feeds. Try to finish your dinner early, and so that the amount of time if you fast, there are some research saying that it can trigger what is called autophagy. Your cancer cells may not be able to survive when you try to fast more. So there are habits like eating beyond 8 o'clock, having midnight dinner, midnight biryani concepts are all coming along. But try to change your food habits in such a way, whenever you buy a food in a shop, try to look at the label and see how many unnamed products are there. If you have 3 or more unnamed products, that means more and more preservatives are there. And educate your kids, and when you take them for a grocery shop, educate them, read the label, what it is. There are some products which says sugar free, but they will use something like maltodextrin, which is 10 times more potent than sugar to cause sugar spikes. Those are the small things. If our generations are learning, we can translate it to our parent generation as well as our future kids, so that everybody will have a good healthy life rather than succumbing to the obesity and other cancer diseases. Thank you.
ওকে, অসংখ্য ধন্যবাদ ডাক্তারবাবুকে এত সুন্দর করে এই বিষয়গুলোকে বুঝিয়ে বলার জন্য। আমরা নিত্যদিন যে কাজগুলো করি সেগুলোর মধ্যেই কিন্তু এই মারণ রোগের বীজ লুকিয়ে রয়েছে। তাই কিছু কিছু অভ্যাস খুব দ্রুত বদলে ফেলা উচিত, তাহলে হয়তো জীবনে ক্যান্সারের মতো অসুখ আসবে না। যদি এই পডকাস্টটি আপনাদের ভালো লেগে থাকে তাহলে লাইক করুন, শেয়ার করুন, আর কমেন্ট করে জানান আজ থেকে কোন অভ্যাসগুলো আপনি বদলে ফেলবেন। আর ততক্ষণ দেখতে থাকুন দ্য ওয়ার্ল্ড আরোগ্য, কারণ খবর এখন এখানেই।